My name is Brooke Pridmore, and I'm with Bevel State, and I'm doing my IV checkoff. First, I'm going to get my patient's chart. I'm going to open it up, verify orders, make sure that the patient has no allergies, no history of CHF, renal disease, mastectomy, AV shunt, and no CVA. Assess lab values and vital signs, and no surgery is needed at this time. Then I will hand hygiene and start gathering my supplies. The first thing I'm going to need is my IV starter kit, my extension set, my 22 gauge, 22 gauge needle, IV catheter needle. I'm going to need my flush, my alcohol prep pads, and my arm barrier. Okay, I'm going to come into my patient's room and I'm going to identify myself. My name is Brooke Pridmore. I'm a Bevel State student nurse. Can I get your name and date of birth? John Doe, 10/9/93. Okay. Okay. I'm coming in to do your IV, doctor's orders. Then I'm going to hand hygiene. I'm going to clean my area. I'm going to make sure that my area is at waist level in a good working position. I'm going to go ahead and start setting out my supplies on a moisture barrier. I'm going to get my IV start kit, my extension set, my alcohol prep pads, the barrier to go underneath the arm, my IV catheter, and my flush. Okay, so now that we have everything laid out, we're going to start opening our packages up. We're going to open up the extension set first. We are going to open up our IV catheter and our starter kit. Then I am going to take the needle and I'm going to prime it. Then I'm going to take this off, put it in the sharps container, attach it to this end, and then take this cap off, being sure not to touch that. Put it back in the package and close it up. I'm going to show that I have 2 3-inches and 2 5-inch tapes. Then I'm going to open the arm barrier and I'm going to stick this up underneath the arm. I'm going to take my, okay, once I place this here, I'm going to assess for, I'm going to assess their daily living, ask them what they do. I'm going to ask them which arm is their dominant arm. I'm going to see if they've had a previous IV or if they've had any problems with any IVs. I'm going to check for edema. I'm going to assess the lungs, and I'm going to ask them if they have any allergies. And they don't have any allergies. I'm going to assess for skin turgor, make sure that the skin is okay. Make sure that there's no extension or distensions or anything going on with the skin, and everything looks fine. So then we're going to go ahead and grab the tourniquet, and we're going to put it up underneath the arm. And we're going to go ahead and turn it. And then I'm going to look and find the vein that I want to use. I'm going to rub it, but I'm going to make sure that the patient has their arm below heart level. I'm going to rub on it. And I'm going to have them pump their hand. And then once I do that, I'm going to take the tourniquet off. I'm going to hand hygiene. I'm going to put on my gloves. Then I'm going to take my alcohol prep pad and start from in the center and work my way out into a big area just in case I have to hit a different vein than one that I initially picked. And then I'm going to allow it to dry without fanning it. Okay, so I'm going to go ahead and put the tourniquet on. Okay, I'm going to grab my IV needle. I'm going to pull at the site. I'm going to make sure that the bevel is up and then I go into a 10 to 30 degree angle. And I'm going to let the patient know that this is going to be a stick and to just relax. Okay, we're going to go 1, 2, 3, stick. Okay, so I notice that I have flashback. So we're going to go 1/4 of an inch in. Okay, and then we're going to slide the catheter in while keeping the needle still in place. Then I'm going to pull and I'm going to hold pressure. Okay, while I'm holding pressure here, I'm going to hold on to this. I'm going to pull the needle out to make sure that no blood comes flying out. And whenever I pull the needle out, I'm going to activate the needle and put it in the sharps container. Okay, so now that I'm holding pressure and I'm holding this, I'm going to come over here and get my extension. Being sure not to touch the inside of that. I'm going to screw that on tightly. I'm going to aspirate. Okay, and then I'm going to go ahead and flush the IV line. Okay, I'm going to then go ahead and clamp it off. Take the needle and throw it in the sharps container. And then I'm going to take my piece of tape and I am going to struggle with it for a second. Okay. And I am going to go up underneath the area. Okay. Then I'm going to chevron fold the tape. Okay. Okay. Okay, so now that I've put this down, it is anchored. So I'm going to go ahead and take my big piece of tape, tape it across here, grab my other big piece of tape, tape it across here. I'm going to initial. I'm going to put the size of the gauge needle, so it was a 22 gauge. I'm going to put the date and the time, which is at 0900, and today's date is 2/9/20. Okay. That's it, right? Okay, so since I've done that, I'm going to go ahead and start cleaning up my area. So I'm going to take this. I'm going to throw that away. I'm going to throw all of this away. I'm going to tell the patient to let me know that if it gets red, starts getting puffy, if it starts feeling warm or anything's wrong with it, to let me know. I'm going to take my gloves off. I'm going to hand hygiene. And then I'm going to let the patient know that, remind her that the doctor has ordered some medications and that it will be in from the pharmacy, and that the pharmacy will call me and let me know whenever it's in. And then I'm going to go ahead and put the bed at the lowest position, call light and reach, and let the patient know that I'll be back as soon as the medication's in the pharmacy. Okay, so since I've left the patient's room, I'm going to document, and I'm going to document the time and date, which is 2/9/2020 at 0900. An angiocath 22 gauge inserted into the right hand. One attempt to using a tourniquet. Connected the saline extension tubing. Blood aspirated and flushed with a 10 millimeter normal saline. No signs and symptoms of infiltration. Secured catheter hub with clear IV tape. And then some facilities, you can dress the site with a TSM, but we did not, because we just did the clear IV tape. And secure tubing with the IV tape. Patient tolerated procedure without pain and anxiety. Instructed the patient to let staff know if the IV sites become painful, red, swollen, or has any drainage. And then I'm going to sign it, C. Pridmore, Bevel State student nurse. Okay. So now I'm in the med room, and I'm looking over the patient's orders at their MAR. The patient's name is John Doe. Date of birth is 10/9/93. Room number 316, MR is 1234. The patient is going to be prescribed Lasix 20 milligrams IV push 2 times daily, one at 0900 and one at 1700. Rocephin 1 gram IV push daily. Normal saline 30 milliliters per hour, and discontinue after IV push or IV piggyback finished. The IV piggyback is going to be given, which is the Rocephin, which is going to be given at 25 drops per minute. Okay, so now it's time to get everything ready. I'm going to hand hygiene. Okay, I'm going to get 2 IV flushes. I'm going to get the Rocephin piggyback, which is 1 gram at 100 milliliters. I'm going to check the expiration date, which it expires October of 2020. And I'm going to check this with my MAR. And it's correct. It's Rocephin 1 gram, IV piggyback daily. For the correct patient, I'm going to make sure that it's going to be administered at the correct time, which is at 0900 and at 1700. And then I'm also going to make sure that that it's given in the right route, which is going to be the IV piggyback and IV piggyback. Okay. Then I'm going to grab my normal saline. The expiration on it is 5/20/2022. I'm going to make sure that it is for the right patient, that it is for John Doe, 10/9/93, with the MR number as 1234. And this is going to be at 30 milliliters per hour. And then it'll be discontinued after the row 7. And I'm going to make sure that it's going to be given at the correct time and date, which would be at 0900. Then I'm going to get my Lasix out.
Oh God, it's back, it's back.
And get everything ready for it. Okay, so the expiration date is October of 2020. 40 milligrams per milliliter, and this is only needing 20 milligrams. So I have plenty of this. Here goes, stop. Okay, sorry. Nose itch. We had to pause for a minute. All right, so I've got the Lasix. The patient is going to be prescribed 20 milligrams IV push at 0900. It is for John Doe, date of birth 10/9/93. MR number is 1234, and that checks out. So I'm going to take my alcohol swab, and I'm going to clean the area vigorously. That dog scared me. I'm going to clean the area vigorously. I'm going to dispose of that. I'm going to take my medications, and it is going to be 0.5 milligrams. So I'm going to pull 0.5 milligrams of air. I'm going to take the top off. And if you can see, I have pulled up 0.5 milligrams of air. Okay. I'm going to push it inside of the medication. And I'm going to turn it up and withdraw. Okay. So I have drew up 0.5 milligrams. Okay. And then I'm going to do the scoop mechanism to recap. And then I have my bag labeled with 0.5 milligrams. IV push. Okay. And then I'm done. So now I'm going to grab my normal saline. And I'm going to start getting it ready to hang on my IV pole. Okay. So I am going to take out the tubing. Okay. I'm going to grab my tape. And I'm going to put it at the lower level because we're going to be doing that IV piggyback. And the piggyback needs to be at the uppermost level. So I'm going to get my IV tubing ready. I'm going to make sure that it is in the off position, and then I am going to tape it back here. And since it's in the off position, I'm going to go ahead and drape this over the sink, and I'm going to cut this back in the on position. I'm going to prime it. Make sure all the bubbles come out. Once all the bubbles are out, I'm going to turn it off, and then I'm going to hang the excess. Okay. Now I'm going to grab my row 7. I'm going to open it up, get my tubing out of it. And since the row 7 is going to be a piggyback, I'm going to take some tape. And I'm going to tape it to the highermost level. I am going to get my IV tubing. I am going to turn it into the off position. And then I'm going to go ahead and remove the cap, make sure it all stays sterile, and stick it in. And I'm going to hold it over the sink, but up, because with it being an antibiotic, we don't want to lose any. So we're going to cut it in the on position, we're going to prime it, we're going to make sure all the bubbles are out, but we're going to make sure that nothing comes out. So we're going to close it off pretty quickly so that we don't lose any of the saline. Of the Rocephin, of the antibiotic. So since we've got this, then I'm going to take my alcohol prep pad. I'm going to clean the area, take the cap off and clean it, and then I'm also going to clean the area where we're going to stick this, since it's a piggyback and it needs to be put there in the Y. I'm going to get my tape, and I'm going to tape it on. Okay, and then since that it is capped at the end to maintain sterility, I have already checked it with the MAR, but I'm going to go ahead and double check just to be 100% sure that this is going for the right patient. That it's Rocephin. The expiration date is October of 2020. It is going for John Doe. Date of birth is October 9th, 1993. MR is 1234. And then the normal saline, expiration is 522. It is going to be for John Doe. Date of birth 10/9/93. And the MR is 1234. So everything is prepped and ready to go. Okay, I'm entering the room. My name is Brooke Pridmore, and I'm a Bevel State student nurse, and I'm coming to give you your IV medications that the doctor has ordered. I'm going to go ahead and take my medications. I'm going to ask the patient, can you give me your name and date of birth? Okay, it is John Doe, 10/9/93. Okay, and your MR number is 1234, and on your bracelet it says 1234. Okay, so everything looks great. I'm going to go ahead and hand hygiene, and I'm going to don gloves. As I'm doing this, I'm going to make sure that the patient has no allergies. Do you have any allergies? Are you allergic to anything? Okay, the patient is not allergic to anything. So I'm going to go ahead and set up my field. Okay, so the doctor has prescribed Lasix 20 milligrams IV push at 0900, and it is currently at 0900. Okay, and Rocephin 1 gram IV push at 0900, and normal saline at 30 milliliters per hour with the IV piggyback. Okay, so I'm going to go ahead and get my Lasix out of the bag. It is 0.5 milligrams. And I'm going to go ahead and check with the MAR that it matches, that it expires in October the 1st of 2020. That it is for the correct patient, which is John Doe, 10/9/93. Okay, so everything looks good. So I'm going to go ahead and go over to the to my patient. Clean the area, the site, for 15 seconds to make sure that it's good and clean. And then once it's been 15 seconds, I'm going to dispose of that. I'm going to take this off. Nope. Sorry. I'm going to flush. Not that yet. I'm going to flush. I'm going to put the IV flush on. I'm going to open the thing. I'm going to go ahead and aspirate. Make sure and then push it in. Okay, and then I'm going to go ahead and clamp her off. Okay, put that in the sharps container. Now I'm going to go ahead and clean the area for 15 seconds again. Once it's been 15 seconds, I'm going to get my Lasix 0.5 milliliters. And I'm going to get it ready. Take the needle off, put it in my sharps container. Going to go ahead and stick it on. And then I'm going to push 1 notch every 12 seconds. So I'm going to go ahead and count it. Okay, 1. Oh, I'm sorry. I'm going to unlatch the area or and then start. Okay. 1. Okay. And I did it once every 12 seconds. Okay, I'm going to clamp it back and then I'm going to take that off and discard a bit. Okay. And then I'm going to clean the area again for 15 seconds. After it's been 15 seconds, I'm going to get my IV flush. I'm going to flush it. I'm going to unclamp it and then I'm going to flush it. Clamp it back. Put that into the sharps container. And now I'm going to go to my normal saline and Rocephin. So my I'm going to alcohol prep this area for 15 seconds. Alcohol prep this area for 15 seconds. Then put it on. And I'm going to keep it clamped for right now so that I can make sure that I have my drips the correct setting. So with Rocephin, it's going to be 25 drips per minute. So that means it's going to be about 6 drips per 15 seconds. So I'm going to cut this on and I'm going to count the drips for 15 seconds. Then once it's been 15 seconds and I've noticed that it is 6 drips, I'm going to go ahead and keep counting for a full minute and make sure that it does equal the 25 drips per minute. Once it's been a full minute, I will cut it off, or I'll leave it the way it is. Sorry. I'll leave it on. Then I'm going to go to my normal saline. I'm going to hold the clamp for it. And the normal saline is going to be 30 milliliters per hour. So that's going to be 25 milliliters. Okay. So the normal saline is going to be 30 mils per hour. So I'm going to cut that on. And now that everything is running like it's supposed to, I'm going to go ahead and unclamp this guy here so that it can run properly. Okay, and then since I've done that, I'm going to go ahead and educate the patient to make sure that nothing's going on. Make sure that they have no rash, no nothing like that. Make sure that the patient is at normal level with the call light and reach, but let them know that if anything changes, if they have redness, burning, anything, any leakage, drainage, or anything to that extent with the IV site, that they need to call me and let me know. And then I'm going to go ahead and take my gloves off. No, I'm going to go ahead and clean the area up. Get everything cleaned up. Put away. And disposed of properly. Then I'm going to go ahead and take my gloves off. I'm going to hand hygiene. And then I'm going to let the patient know that I'll be back in an hour once all of this should be, the IV should be finished. Then I'm going to be documenting on the MAR that I gave the meds at 0900. Okay, so now that it is later in the evening, I have physician's orders to go ahead and discontinue the IV for John Doe, date of birth 10/9/93. Okay, I currently do not have any abnormality lab reports to report at this time, so I'm going to go ahead and go into my patient's room. So I've gathered my supplies, so I'm going to knock. Hey, my name is Brooke Pridmore. I'm with Bevel State Student Nursing, and I'm here to discontinue your IV. Can you give me your name and date of birth, please? Okay, and they said John Doe, 10/9/93. Okay, their MR number is 1234, and it matches up. Okay, so then I'm going to go ahead and hand hygiene, and I'm going to don gloves. Okay, and once I have my gloves on, I'm going to look up here and see that they are done. So I'm going to cut this one off. Cut this one off as well. Okay. I'm going to get my barrier to go up underneath the arm. Okay, so I'm going to go ahead and clamp this off. And since everything's off, I'm going to go ahead and unhook this. And with the little bit of saline that's left in there, I'm going to go ahead and cut these on and let them drain completely in the sink. And then once that's all done with, I will go ahead and disregard in the trash. Okay. So now I'm going to come over here to the patient, and I'm going to go ahead and start taking off the tape. And I'm going to do this pulling it off instead of cutting it with scissors, because you don't want to cut the catheter. Okay. Okay, before I start taking the tape off, I'm going to go ahead and get some alcohol prep, and I'm going to clean the area. And I'm going to assess the area for, I'm going to check the area for inflammation and phlebitis. And everything looks clear and it's all cleaned up. So I'm going to go ahead and start taking off the tape. Okay. Throw that tape away. And then I'm going to secure the area to take the tape off of this. And once the tape is off, I'm going to get my 2x4s. I'm going to hold it, but I'm not going to apply pressure until after I have pulled the catheter out. I'm going to go ahead and pull the catheter out. I'm going to hold pressure for 30 seconds, and in the meantime, I'm going to go ahead and inspect the catheter, make sure that the tip is intact and that it is the same length that from when we put it in, and everything seems to be intact. It seems to be the same length. Everything seems to look good. So I'm going to go ahead and throw that into my sharps container. I'm going to hold the pressure for 30 seconds. After 30 seconds, I'm going to go ahead and lift up the gauze and look. Okay, they're no longer bleeding. I'm going to go ahead and get a Band-Aid. And I'm going to put a Band-Aid over the site. Okay, and then I'm going to instruct the patient to let me know if they have any redness, if the bleeding gets any persistent, if they start having pain in the area, if swelling happens, or if it starts burning or anything to that matter. Then I'm going to start cleaning up the area. And I'm going to take this out from underneath the patient's arm. I'll throw it away. I will go ahead and put the patient's bed at the lowest position. Put call light in reach. I'm going to take my gloves off. Hand hygiene. And then I'm going to go and document. And then with my documentation, it's going to be 6/10 of 2020 at 1800. Order received to discontinue IV catheter. Angiocath 22 gauge removed from right forearm or right hand. Catheter tip intact. No redness, swelling, tenderness, nor drainage at the site. Pressure applied to the site for 30 seconds. Bleeding stopped, and sterile 2x2 gauze dressing applied with a bandage over the top. Patient tolerated the procedure without pain and anxiety, and I instructed the patient to notify staff if bleeding or discomfort occurs. Signed, Brooke B. Pridmore, Bevel State student nurse.